It is an honor to present our research. I will present the findings of our study titled, Age-Related Changes in Bladder Contractility in Male Patients with Lower Urinary Tract Symptoms, with a particular focus on how bladder outlet obstruction affects these changes. This study used urodynamic data from over a decade of clinical experience. As the global population ages, lower urinary tract symptoms have become increasingly prevalent among elderly men. In Korea, the elderly population is projected to exceed 20% by 2025. One important but often underappreciated cause of lower urinary tract symptoms is declining bladder contractility with age. However, many of these elderly men also have BOO, which can confound our understanding of true bladder function. Previous animal studies on aging and the bladder have yielded mixed results. Some show preserved contractility, while others showed decline. In humans, data are limited because urodynamic testing, although the gold standard, is invasive. More importantly, BOO itself may obscure the interpretation of bladder contractility in elderly patients. This study aimed to answer two questions. First, how does bladder contractility change with age in men with lower urinary tract symptoms? Second, how does BOO influence or mask these age-related changes? Ultimately, we hope to guide more individualized treatment decisions. We conducted a retrospective cohort study of 449 men aged over 40 who underwent urodynamics studies between 2012 and 2024. Patients with neurologic diseases, prior pelvic surgery, or radiation were excluded. All patients were receiving medications for lower urinary tract symptoms, and we did not perform a medication washout to reflect real-world conditions. BOO was defined using the Bladder Outlet Obstruction Index, with values above 40 indicating obstruction. We used the Bladder Contractility Index to assess contractility. We also recorded whether detrusor overactivity was present. Patients were categorized into BOO and non-BOO groups. Those with equivocal obstruction were excluded. We analyzed clinical variables including PSA, prostate volume, maximum flow rate, post-void residual, and BCI. Pearson correlation was used to assess age relationships. Multivariable linear regression was performed to adjust for confounding variables, especially BOO. Out of 449 patients, 311 were classified as having BOO. This group had significantly larger prostates, higher PSA levels, and lower Qmax. Interestingly, the BCI was higher in the BOO group, but this was likely due to the mathematical formula. The mean age was similar in both groups. In both groups, maximum flow rate declined with age. However, only in the non-BOO group did post-void residual volume increase significantly. Functional bladder capacity and detrusor overactivity also showed age-related changes, but again, only in the non-BOO group. The key finding was a significant inverse relationship between age and BCI in the non-BOO group. In the BOO group, this relationship was not significant. This suggests that BOO may mask age-related decline in bladder contractility. Our multivariable analysis confirmed that BOO is a confounding factor. Previous studies have shown mixed results, likely because many did not control for BOO or medication use. By excluding equivocal BOO and clearly separating groups, our study isolates the effect of aging more effectively. We found that aging does impact bladder contractility, but the effect is modest. What does this mean for practice? First, clinicians must consider BOO status when evaluating elderly men with lower urinary tract symptoms. Second, not all patients experience contractility decline, so treatment must be individualized. Urodynamic study remains important for making these distinctions. Our study has several limitations. It was single-center and retrospective. Because it was cross-sectional, we inferred rather than directly observed changes over time. There was no medication washout, but this enhances real-world applicability. And lastly, aging is likely one of several factors influencing contractility. In conclusion, aging reduces bladder contractility in men but only significantly in those without BOO. BOO must be considered when interpreting bladder function. and treating LUTS. Urodynamic testing remains crucial to tailor treatment appropriately in elderly men. Thank you.